So find your comfortable seats. And you can rest your hands on the thighs, just gently resting the hands on the thighs. Yeah. And you can close the eyes, or you can have the eyes half open, gazing somewhere on the floor in front of you, with a soft, gentle gaze. And allow the attention to turn into the space of the body. So you're orienting inwards, orienting into the space of the body, as opposed to orienting your attention to something outside of you. So we're orienting inwards. So just notice that shift. And we'll begin by tuning into the natural breath. So just noticing as the breath moves in through the nostrils, through the body, and then back out through the body and out through the nostrils. And without changing the breath, so allowing the breath to be natural, and allowing the lower belly to be soft. So notice if you're pulling the lower belly in. Relax the lower belly, soften the lower belly, and allow the inhale to move into a softening belly. And as you exhale, allow the lower belly to naturally move back towards the spine without forcing it back, without using muscles in the belly to push the breath out. Allow the exhale to be natural and to be passive. You might have some resistance to this way of breathing. And just notice that without creating a story around that or understanding why. Just notice if there's any resistance to breathing into a softening belly and then allowing the exhale to be passive. Even if you're not fully breathing in and fully breathing out, that's okay. Now gently, we'll begin to apply Ujjayi. So bringing a tone to the vocal cords and allowing the tip of the tongue to rest at the root of the teeth. So where the back of the teeth and the roof of the mouth meet, allow the tip of the tongue to rest there. And then allow the rest of the tongue to relax down to the root of the mouth, to the base of the mouth, the bottom of the mouth, so that the tongue isn't touching the roof of the mouth. And we'll begin to tone the vocal cords for our Ujjayi breath. Notice if that helped to lengthen the breath a little bit. So we're toning the vocal cords, which is the same action we make when we're whispering. And maybe you begin to hear sounds for the breath. Kind of sounds like the ocean, or like when you put your ear against a shell. Continue breathing into a softening belly. And allowing the exhales to be passive with a tone in the vocal cords. Without over-engaging the throat muscles. So notice if you're tensing the soft palate or over-engaging the throat, only toning the vocal cords as if you're whispering and releasing any tension in the throat as you breathe in and out. And we'll continue breathing in this way, and now we're going to begin to draw the lower belly in. So at the very, very lowest part of the lower belly, just above the pubic bone, you're going to draw it in and up. And try to do this without sucking the whole belly in. So it's not like this abdominal engagement to push the lower belly in. It's just drawing in at the lowest part of the lower belly, just above the pubic bone, so that when you breathe in, you can continue to feel this breathing into the pelvis, into a softening belly, as we tone the lower belly. And keeping it drawn in as you exhale. Feel the pelvic floor starting to lift. We'll just take a few more breaths like this. So as you inhale, let the lower belly be soft. Breathe into a soft lower belly so that you can breathe into the pelvis. and just draw in above the pubic bone. When you do this, you breathe into the pelvis, and you also allow the rib cage and the diaphragm to expand and spread out. Maybe the chest also begins to lift and expand. So you're expanding the container for the breath to move in, and then allowing the exhales to flow out naturally. And that lower belly drawing in is a little bit of an extra help, an extra push to continue pushing the breath out. So keep that lower belly pulled in throughout the whole breathing. Good, take one more round like this. And gently begin to release all the technique. Release the lower belly, drawing in. Release the tone in the vocal cords. And go back to a natural breath. Go back to the breath as it is, breathing into a softening belly, and then passively allowing the exhale to move back out. Noticing any residue. Notice any sensations in the body. We'll gently open the eyes if they were closed.